Hey, Dr. Madsen here. This is a little talk to go along with your handout on sleep trackers. Sleep trackers. So there's lots of different kinds of sleep trackers that we use as a tool to help us learn about our sleep patterns. They can be Fitbits, like yay. This doesn't happen to be a very good one. They can be an Apple Watch or similar Apple Watch, or you can have a cool Oura ring. So far, we've done lots of experiments with lots of different ones, and a lot of people have Apple Watches and they're actually pretty good. The more expensive Fitbits seem to be good. The inexpensive Fitbits are not. The Oura rings seem to be pretty good. You can get one of those buggers for less than $100. And you can do the shopping, you can talk to us. We just keep doing more and more to see what kind that we can get that work better. But so far, the people have Apple Watches like the Apple Watches. The Oura rings seem to be a close second. And some people don't like wearing their watches to bed, sort of weird. So the benchmarks that we're looking for are, they're written down here on your handout, the total number of hours you sleep. The goal being you want to get to 7 to 8 hours. We want to track the number of awakenings. This is sort of the printout that you'll get. One similar to this. They're all a little bit different, but it'll break up how many times you wake up, the light sleep, the deep sleep. Sometimes the deep sleep is broken into deep sleep and REM sleep. You just sort of have to look at the app that you're using, and they're very informative. You probably should keep a sleep log. What the goal is you want to be, and these will track it too, you want to go to bed within 2 hours every night, so between 7 and 9, or 6 and 8, or 10 and 12, and get up pretty much at the same time. That helps with the circadian rhythm. Sleep is broken down. You'll see here, they'll call it there's N1, N2, N3, N4. N4 is REM sleep, N3 deep sleep, 1 and 2 are light sleep. The Apple Watch, they call it the core sleep. You can actually download it. It's Apple Watch users get 49 minutes of deep sleep per night. So there's all these terms that are written down here on the benchmarks, and those are what we're going for. And you say, so why am I going for that? What happens if you're not getting good sleep, you're not going to get into ketosis, you're not going to burn fat, and you're not going to lose weight very easily. So it's a big factor in that. It's a big factor, and if you don't get enough sleep, you end up with a lot of chronic inflammation. Inflammation such as cancer, heart disease, dementia, cerebral vascular disease, diabetes, those are all inflammatory problems. If you don't get enough sleep, it screws up your blood flow up to your brain, and it can lower your learning as much as 40% the following day. It was a sort of neat study we read about. It can also cause what we call microsleep. It's like a few seconds every day because you didn't get a good night's sleep the last night. You got, You just sort of lose it. You space out. That's a common term. That's from sleep, not getting enough sleep. Also, they did a study. They found out that 19 hours of no sleep, you can have the cognitive impairment equal to a legal alcohol level of 0.08 OMVI. So there you are. That's what happens if you don't get enough sleep. Causes of insufficient sleep, that's the next one. So sometimes sleep apnea, which is we'll talk about that in a minute a little bit, that's a big deal. Narcolepsy, restless leg syndrome, those are the 3 big ones. Neurologic conditions can cause sleep deprivation. Parkinson's disease or Alzheimer's can cause that. Medication use, antidepressant, usually the tricyclic antidepressants. Antihistamines, people take Benadryl. Years ago, we used to use Benadryl in the hospital for everybody. But Benadryl makes you sleep, but you get light sleep. You don't ever get down in deep sleep, so it's pretty much worthless sleep. Blood pressure medicines, not all of them, but some of the central acting blood pressure medicines. Substance uses within 4 hours of going to bed. So if you're drinking alcohol, drinking caffeine, or using nicotine 4 hours before you go to bed, good luck with deep sleep. It's not going to be available. at least not as much. Eating supper within 3 to 4 hours of bedtime, that's another one, particularly if it's high in saturated fat. The stress, anxiety mess with your sleep. Getting older, it'll mess with your sleep. And even the sleep hygiene, like they've done studies, this is sort of cool. You'll go to sleep, your eyes are closed. They actually, if you remember when you're a kid, you ever lift somebody's eyelid and you see the whites of their eyes because their eyes roll back? So when you're asleep, your eyes are in the back of your head. Well, what happens is your body can still sense when there's light. So if you have your phone sitting there and you have it turned off, but the light clicks on and off, it'll mess with your sleep. Check that out. Or some people will sleep with a TV in their room and the noise, the noise turned down, but the light of the TV of the show is on and off, screws up with your sleep. So those are lots of different things that will cause insufficient sleep. A couple of the big ones, so sleep apnea. There are 1 billion people in the world that have sleep apnea. 30% of USA adults have obstructive sleep apnea. And obstructive sleep apnea is a big deal because it leads to stroke, heart failure, coronary artery disease, dementia, arrhythmias, diabetes, and obesity. So everybody thinks it's just that they're snoring. It's a lot more than that. In addition to snoring, people tend to wake up tired. They'll wake up with a headache. They'll want to have an afternoon nap. They're usually overweight. Their neck size is usually large. In fact, did you know this, that like 95% of professional football players have sleep apnea? It's because they got these big necks. So if you're ever thinking about being a pro ball player, get used to the idea of having sleep apnea, at least football players. Okay, sleep disorders and the effects on the circadian rhythm. That's why the circadian rhythm is the rhythm we go in and out every day, same rhythm. If you are not sleeping at a fairly consistent schedule, it's going to screw up your sleep. It's going to screw up your sleep circadian rhythm, and you're not going to sleep well. And you're going to have all those problems. This is sort of cool. The American Academy of Sleep Medicine has spoken out firmly. They put a position statement out against daylight savings time, saying it screws up stuff, ends up increasing heart disease, stroke, arrhythmias, inflammatory markers, hypertension, car crashes increased, apparently with daylight savings time, and fatigue, diabetes. So lots to speak out against, particularly Southern's swing shift or working nights and then going on to days, and it's a mess. It'll screw up your circadian rhythm. Try not to get those jobs. Your diet and sleep. If you eat food, we've said this before, 3 to 4 hours before you go to bed. A lot of the calories are going to be stored as fat. They're not going to get burned, and you're not going to sleep well. 4 times more likely to have night awakenings if you're eating before you go to bed. In the USA, eating patterns in the USA, this is sort of interesting. 11 eating events per day for the average American. 25% of the food is eaten before noon. 35% of the food is eaten after 6 p.m., which is a no-no. And most weekends we eat later because we stay up later. So the bedroom environment, if you're trying to get your sleep turned around so you can lose weight a little easier or that you're just feeling better, avoid bright lights, dimmers in the bedroom. No screens in the bedroom. That includes no TVs. There's a lot of research on that one. Blackout curtains in the bedroom, particularly if you are trying to sleep during the daytime. Earplugs if it's noisy in the house. Keeping bedroom cool. A lot of times people drop the temperature on their thermostat 4 to 5 degrees when they go to bed. If you're not falling asleep within 10 to 15 minutes, get up, get out of bed, get out of the bedroom, and then when you're tired, go back. Don't just lay there and toss and turn. Make sure the pillows, the mattress, the linen are comfortable. They also say don't switch around. People that travel a lot, that sleep in hotels, then they're home, they have a lot of trouble with sleeping because they're switching beds every night. Okay, so here's the summary on good sleep. Cut out or cut back at least on the alcohol if you're drinking it within 4 hours of going to bed. Likewise, same thing with caffeine, same thing with nicotine. Eat supper earlier. Cut out the saturated fats out of supper. Put them in breakfast and lunch. Minimize the bright lights in the evening. This is sort of weird. They have studies showing, used to think this was all sort of screwy, but it's legit. If you have 2 sets of lights, so this room has 4 lights around the edge and one in the middle. The middle one's a yellow light. So what you're supposed to do in the evening, turn off the bright, leave the yellow light. And that tends to help your brain cool down. Maintain regular exercise every day. Cut out the ultra-processed food. We got lots of videos on that one. Rule out sleep apnea, narcolepsy, restless legs. Restless legs is the one where your legs jerk when you go to bed. You're laying there and they just jerk, or you feel like you got to wiggle your leg to be calm. Stress, take a bath, read a book, listen to sedating music, meditate, whatever. Sometimes food logs will help you identify certain things that trigger so you can't sleep. Get up at regular bedtime. So that's why we want you to get a ring or a watch or a band so you can see what your study is. We have a lot of people come in for weight loss and they want to focus just on the medicine. The reality is these tools that we talk about, like sleep, if your sleep screwed up, good luck on weight loss. It isn't going to occur very easily. So that's the 10 cents on that one. Have a great day.